When I tell my patients who are runners and are either pregnant or are newly postpartum this, they hate it. They hate it. But the guidelines for returning to running after you have a baby is to wait for 12 weeks. I know that you get cleared for exercise at 6 weeks, but all of the recommended guidelines for return to running after having a baby is to wait for 12 weeks. And there are reasons why. A lot of hormonal changes that are happening right after you give birth, especially with estrogen, which is really important for tendon and tissue health. And we get this really big decrease in estrogen right after we give birth that stays suppressed if we're breastfeeding. And estrogen is really important for your tendons and your ligaments. And if we get back to running too early, too fast, we put ourselves at a higher risk for musculoskeletal injuries, muscle strains, tendinopathy, ligament tears, all of those fun things that you don't want to have to deal with when you're trying to get back into activity. Also, your pelvic floor is healing. During birth, your pelvic floor has stretched out like 300% of what it normally does, and it needs to heal. It needs to kind of come back together. We often will have some nerve damage that happens during giving birth. That nerve needs to heal up, and all of this just takes some time. So light activities, gentle exercise, absolutely can be encouraged and should be encouraged early postpartum, but something that's a little higher intensity like running, and I might add heavy weightlifting, things like CrossFit, it's recommended to wait for at least 12 weeks before getting back. And I would even say 12 weeks is for the people who are preparing to run, who have run in the past, who do all of the prep to run during that postpartum period. If somebody's a little iffy, having a lot of pelvic pain, having a lot of issues, I would generally recommend waiting even longer.